life-changing moment for you. I spend months putting the information together. I talk to those of you that are my patients. I listen to what you need to hear. I know where you want to go. I know that some of the guests that are coming, what they need to hear. And I do it all because I want you to leave today and change the direction that your health is heading. And if you're here because you're kind of curious, and you're like, well, your friend dragged you here, or maybe your spouse dragged you here, I have good news for you, because what I'm going to say and what some of the other speakers are going to say for the next 2.5 hours is what you probably should have heard about 30, 40 years ago. So last night I was at something called LunaFest. Anybody ever heard of LunaFest? Anybody ever heard of the Breast Cancer Fund? So we were paying tribute to a dear friend of mine who I speak about a lot, and I'll tell you more throughout today about her, who at 40 got a diagnosis of cancer. And she felt good, she looked good, she had an amazing job, she had an amazing community, she was kicking butt in life. And she went in for a routine mammogram, and she came out with a cancer diagnosis and 3 months to live. Not one symptom. And she said, not me. I have 2 young children. That's not going to be my course. I'm going to do something different. And so she did something different, and she turned it into 11 years. She passed about a year ago around this time. And last night we were honoring her, and we had about 150, maybe 200 people in the room. And I asked people, and it's what I ask in a lot of my talks when I go out to corporations, how many people have a plan? How many people have a health plan? How many people, and let's just do it here in this room, how many people in this room right now would say the life you're living is not going to build you cancer? You're really clear you're doing some good stuff that's not going to build you cancer. All my patients should be raising their hand. Raise your hand. Yes. Okay, so when I go into corporations, I've gone into over 50 corporations since Lanny died. Because Lanny's message was, this is not a disease, this is not a condition that's happening to me, it's happening to us. And what I'm going to teach you today is principles she should have been taught when she was younger. And when I go into these corporations and I ask them that question, there's usually 40, 50 people in the room. And I always start off and I say, okay, who has a plan to fight cancer? And most people laugh. A couple of them raise their hands, most people laugh, and they're like, oh yeah, like there's a plan. So I'm going to show you the plan. So whether it's cancer, weight loss, you're in chronic pain, you've got chronic fatigue, you're on 20 different medications, what I have spent the last several weeks doing is putting together a PowerPoint that if you were to sit down with me one-on-one and ask me what are the most important things that I could do for my health, this is what you're going to hear today. But the most important thing that you have to know is that you're powerful. So, I mean, you guys have come to me in really bad situations. You so often hear that you're not powerful. It's the pill that's powerful. It's the surgery that's powerful. It's the doctor that's powerful. That's not the case. You're powerful. And if you ever doubt it, you either just need to go hang out with me a lot, or you need to start researching.